What I'd like to do is invite you to join this red co-production bus. I don't know how public buses look like in Sweden, but in England, as you know, they are all red. And I'd actually, let's see if this is working, would like to start with a question to you, which sounds pretty simple. What do you think people with visual impairments need most? And I'd like to invite you to discuss this question with your neighbor, either to your left or your right, depending on your political orientation. Okay? So 2 minutes. So any suggestions? Why not ask you two first?
Our answer is we don't know.
You don't know, okay.
Because only they will know.
Okay, that's great.
Sorry.
But some ideas, money?
Money, yes. Glasses.
So,
Glasses.
glasses? Okay, if you're blind, that may not quite be the solution. Information on
Specific. So this is the supercomputer citizen.
Okay.
Edward mentioned. In
So
their
more
language,
information
and
about
the
support
tools they could use.
in Braille language. Okay. Any suggestions from this corner?
Yeah, we were talking about that they need to have an environment that suits them.
Okay. So supportive environment, so they can get out and about, for example. Okay. Giovanni?
I need to temporarily experience the problem, and that's
To
one
know.
thing.
So you
And the
would
other-
even go one
yeah,
step further.
And the
then?
other one was having a person I trust beside me. That means that I will try to be independent, but I know that if I need, there is someone there that I can trust.
Okay, interesting answer, Giovanni. I'll get back to your answer. That's great. Thanks a lot. I cannot ask everybody given the time limit, so apologies. Exactly the same question was asked in a scientific study to 1,000 public sector workers, and you can see what they said. The large majority said more information about the stuff we are doing for blind people and more information about specific support like a blind dog and so on. Then exactly the same question was asked to blind people themselves, and here you can see what they said, and this brings us back to Giovanni. Get to know people, make friends, 91%, and 62% said, I need to have someone to talk about personal issues. So I think that brings us back to Rian. We don't know, we make wrong assumptions, so the answer is we got to ask people, which brings us to the role of consultation, still necessary and always needed, in particular when we talk to people where we know nothing about the conditions. So, we need to ask, but I think it also shows us that we need to rethink the way we deliver public services. Question to our Swedish colleagues, do you know any Swedish local authority which has a budget title for friendship? And you mentioned money, Martin. And any local authority
That
has a budget, a specific budget for friendship. But that's what's needed, 91%, that's what they want to have.
For assist voluntary workers.
Okay,
Because, it's about friendship.
exactly.
Things like that.
So the issue is maybe not so much to deliver more services for this specific target group, but to help them to connect, which brings us to a new role of local government. And also in the UK, I'm sure Catherine, for example, knows about Lambeth. They now start to invest money into such initiatives. And that brings us to co-production, to be more precise, to collective forms of co-production, because what people want here is doing stuff with other people, have more friends, but also have more support. And for those of you, I know it's a clumsy term. If you can help me out, Edward, what is it in Swedish, co-production? Is there a word for it?
I'm not sure it's a term which is widely used. I guess the direct thing would be something like medproduktion.
Right.
But don't we actually use the word co-production?
Yeah, we use it.
You use the English word. Okay, easy way out, yeah. That's also what I do in German. Well, what I always say, it takes two. As you can see, the English, at least equivalent, fish and chips. I don't know if that's popular in Sweden, but the official definition we have, it's about public services. It means professionals and citizens making better use of each other's assets, resources, and contributions to achieve better outcomes or improved efficiency. But of course, there are more definitions, and I think the key thing is that in each context, people come up with their own understanding and their own definition and language of co-production. So the issue is how much of this is happening already. Well, we've done a survey in 2008, I talked about yesterday with Catherine. We found out quite a lot of stuff is already happening, but funny enough, most professionals don't see it, which is normal because we all see what we're doing ourselves, but we don't see what's happening out in the street, in the houses. This is statistics on collective co-production, slightly different from the statistics in the folder, which is about, which also includes individual forms of co-production. But what you can see here, if you are a pessimist, you would say not much happening, but if you're an optimist, you could say, well, the class is almost half full, but there's, of course, potential to do more. So challenge number one, there's a lot, citizens are actually quite active, but it's often not perceived by professionals. And this means that professionals have to raise a new question, and this question is not just asking what services do you need, that takes us back to the blind people exercise, but actually asking people, what can you do? And unfortunately, this question isn't asked very often because I think most local government is very scared to receive the following answer. But actually, when you do ask people, you know, they're not as appalled. They are actually quite happy to do more. So when we ask citizens, are you willing to do more to improve your local environment, your own health, or public safety? As you can see here, actually 70% said, yes, I would be, you know, given the conditions are right. And that, of course, tells us there's a lot of potential. So I'm sure now Anna Karin's question will be, where do we find these people? And that brings us back to demographic change, which is something Edward has already mentioned. The good news is that actually people are getting younger. We are all getting younger because the remaining lifetime, the time we have until death, is getting longer, which means there's a longer period everybody has where we are fit, able to contribute. And as we found out, even people with a lot of needs, the biggest need they have is to be needed. People want to do stuff and be appreciated. So these are the three challenges I pointed out in the paper. And the question is now, how is this going to impact on local government? I think that even when we look in Sweden, and I'm sure our Swedish colleagues can update us on what's happening in Sweden. There's already a lot happening in terms of co-production. What we do see are different forms of co-commissioning, co-design, co-delivery, and co-assessment. That's the inner circle of the co-production star. And just very quickly, I know we don't have a lot of time. Co-commissioning, I have to admit, I haven't found an example from Sweden, but maybe you can fill that gap later. But co-commissioning, where is Jochen here? That can be done at an area, neighborhood level, participatory budgeting, also a terrible word, by the way. But it can also be done at micro level, asking service users, so far so-called welfare recipients, the question, what can you do? And as it turns out, as we found out, you know, people, even 90-year-old ladies with lots of long-term conditions, they still want to do stuff and help others. Co-design, ESTA approach, has somebody of our Swedish colleagues or our international colleagues heard of it? Have you? ESTA approach. It may be more famous outside Sweden than in Sweden, but it's become a famous example. I don't know, Catherine, if you've come across it in the NHS, but it's become a famous example for co-designing services. Co-delivery can take lots of forms. We've got a great case study, one of my favorite ones from Umeå, which is European Capital of Culture this year, co-designing arts with kids, where kids do the artwork and then it's being delivered by professionals. This here takes us to hospital in Sweden, more exactly to a ward where one consultant has turned things around. And again, I think a picture says more than 1,000 words. If you do an eye test and look at this graphic, it will strike you that not the consultant is at the top looking down to the patient, as this is typically the case, but the patient is in the middle with his social network, and also the medical staff works as a team, which is quite unusual. And last but not least, I just thought last night a special case for Anna Karin. You said there are some people who still believe in new public management. I think one way to trap them is to involve citizens as inspectors to do quality performance assessments, and that often again leads to forms of co-delivery. So you may want to look into that Scottish case study. So what we do see, lots of experimentation with new forms of service delivery. And I guess Andy may raise the critical question, what does that have to do with participation? And I agree, a lot of that is quite, basic involvement in public services. But I would like to make the hypothesis that by involving people in public services, by getting them more active in their neighborhood, a lot of them may become politically more interesting, actually get involved in wider political issues. So co-production may be a way to strengthen local democracy through the back door, but of course needs to be statistically tested. Last question, is co-production a new answer for the Swedish welfare state? I cannot answer the question. That's a question for our Swedish colleagues to answer. In particular, I would like to invite Anna Karin to comment on that. So thanks a lot.
I think that was fantastic. There's a really good takeaway from me in there, which I think if we only had to have one thing from today, which is what was really clear from that survey right at the front is we're not the experts in other people's lives. And I think that's so important. We almost, when you come into government, I think that should be tattooed somewhere where you see it every morning in the mirror. You're not the expert. You might be the expert in the process and the systems and how these things can work. You can do an awful lot, but you can never be that other person. So we have to have the conversation and ask them.